So the other organ that is very important is the liver, because the liver produces, for example, coagulating factors. So how the liver is going to be able to release the coagulating factors into the blood? Well, that is possible again because we have sinusoidal or discontinuous capillaries. So they have wide spaces between the cells that will allow these coagulating factors to go into the blood, so they can be part of the blood flow. So after that, we have capillary beds, which are the set of capillaries that you're going to find in between the arterial, the venule, and the arterial. So the blood flows this way and it goes through the capillaries. And obviously, through the capillaries, as I was saying, the diffusion of the multiple different substances from the capillaries to the cells and from the cells to the capillaries, that's what's going to happen. So let's keep going down, and we can see now the veins. So we talk about the arteries, we talk about the capillaries, we are going to talk about the veins in this case. So the veins, same thing, we said we have large veins, medium veins, and small veins, even though in some other classifications there might be, because there's other sizes kind of like in between, as you can see here. So we said we have the venules, then you have muscular venules, medium veins. These two, they be classified as one, but these are going to be small. Then you have the medium veins. You can see here it has the valves that we already talked about it. You have venous sinuses, okay, like the coronary sinus. I'm sure you remember that. I explained the coronary sinus is the one that's going to collect most of the blood coming from the veins before it gets released into the right atrium. And then you have the large veins. Okay, for example, large vein obviously is going to be the superior and inferior vena cava. So if we scroll down, we have circulatory routes. We said the blood comes from the heart through the aorta into the multiple different organs, right? And this is what we're going to see later on. So then, right here you have anastomosis. Anastomosis are connections in between multiple different blood vessels, and sometimes anastomosis are going to help us skip the capillary beds because it's necessary. Like for example, in this case, you can skip the capillary bed. This happens, for example, at the level of the fingers. Okay, sometimes that's necessary. Okay, so we go down here and we say we have anastomosis, and that's about it for this part. The next topic is blood pressure, resistance, and flow. This got to do more with physics again, but we need to talk about this since obviously this is blood pressure, right? So, since these are blood vessels. So blood vessels, what they do is they provide or they supply the organs with blood. And obviously they are going to allow blood flow, right? Which is the amount of blood that goes to a specific organ. Perfusion is the amount of blood that goes through an organ from the organ perspective. So, for example, you have a bone and you have the ovaries. So let's say we have 5 liters of blood. 5 liters of blood goes through the bone. 5 liters of blood goes through the ovaries. But overall, the ovaries have a smaller size than the bone. So therefore, the ovary gets the 5 liters, but the perfusion, which is the amount of nutrients and oxygen that it's going to get, is more than the amount of nutrients and oxygen that the femur, for example, is going to get. Why? Because the femur is big, so therefore the amount of perfusion is going to be less. So you have the same amount of blood, same flow, 5 liters in the ovaries and in the bone, but the amount of perfusion is going to be less in the femur and the bone than in the ovaries. So that's what perfusion is. We go down, we can see blood pressure. Obviously, blood pressure, you have two main components, systolic pressure and diastolic pressure, right? The difference between the two is the pulse pressure. There's a very important concept, which is the mean arterial pressure. The mean arterial pressure is not just an average between the systolic and diastolic pressure, because the systole and the diastole don't last the same. Right? Diastole usually lasts a little bit longer than systole, therefore it cannot be the average of both. So then systolic pressure and diastolic pressure, most of the time, that's an average of what? We said systolic is 120, diastolic is 80 more or less, right? So then the pulse pressure, as you can see here, is 120 minus 75 or 80 is going to give you 40 or 45 millimeters of mercury, right? Mean arterial pressure can be like that, so it's going to be 75 plus 45 divided by 3. This is just they just use 1/3 of the pulse pressure, as you can see here, in order to get that. And on average, that's going to be 90. This varies. See, as you can see here, 62 and 180 in the areas of your legs, for example, 62 is around your head. So there's a whole bunch of numbers in here that I don't think is for you, are going to be necessary for you to know. But you need to understand there is a concept called mean arterial pressure, which is not the average, but rather 1/3 of the systolic and the pulse pressure. Okay, that's just a concept again. So if you keep scrolling down, most of a whole bunch of diseases that happens, or disorders, as it says in here, syncope, atherosclerosis, and all those things, they are more related to the mean arterial pressure than the other blood pressure and things like that, you can say. But again, those are just concepts that you don't necessarily need to know for this part of the anatomy and physiology. Okay, so we keep scrolling down, and you can see here, obviously, systolic pressure is higher than the diastolic pressure. And now in here, obviously, they are talking about atherosclerosis. Atherosclerosis is the hardening of your blood vessels over time. Remember, your blood vessels are going to be, they can expand and contract a little bit, and that's going to help us to maintain the blood flow that happens at the level of the blood vessels. However, as we get older, this small elasticity that the blood vessels are going to have, it disappears because the blood vessels become rigid, not only because of aging, right, but also because of atherosclerosis. So that's why, since the blood vessels become rigid, they lose this elasticity that they have. Their blood vessels cannot expand. Therefore, most of the time in old people, for example, the blood pressure increases to 140 over 100, let's say. But people with old age have higher blood pressure than people who are, 20 or 30 years old. So how do you call this increasing pressure? Obviously, we have hypertension, right? And we also have hypotension. Usually blood pressure higher than 140 over 90 is considered hypertension. And obviously blood pressure lower than, I don't know, maybe 100 over 60 is considered hypotension. Okay, so now blood pressure is what determines your blood pressure? Fairly simple, cardiac output, right, which we already talked about it right here, cardiac output, blood volume, and resistance. Right, remember, blood volume is a part of your cardiac output, because obviously cardiac output is the amount that you're going to pump right from your heart, and that's going to give you your blood volume. And resistance is the forces that will stop this blood from flowing. We're going to see that in a little bit. Blood volume is also controlled by your kidneys. We're going to cover that later on. We talked about already cardiac output, so let's talk about resistance to the blood flow. So we have peripheral resistance. What's the peripheral resistance? Are all those forces that are going to stop, or they are going to try to stop the blood from flowing. So what are these things? Blood viscosity. As we said, if the blood is thicker, if the blood is more viscous, such as in the case of, let's say, a whole bunch of red blood cells in your blood, then obviously that's going to slow down the blood flow. Therefore, it will affect your blood pressure. Okay, blood viscosity obviously is a main concern, because again, if you have a lot of red blood cells, they're going to, when they flow, they're going to touch each other, produce friction. Therefore, they're going to reduce the speed at which the blood flows. And that's why it says in here, erythrocyte count is important, because if you have a lot, then the blood will flow slowly, but if you have a little, then the blood is going to flow faster. And this obviously is going to affect the peripheral resistance, because if you have more red blood cells, then the resistance will increase. Vessel length, also very important concept. If you have a small tube from your faucet to your sink, the blood will flow. But what happens if you have a long tube from your faucet to 10 miles away? That's how long the tube is. So then obviously the blood, the water from your faucet will not even come out. Why? Because this is a very long blood vessel. It's a very long tube. So the longer the tube it is, the less blood flow you're going to have, the smaller it is, the more flow you're going to have. So therefore, the vessel length also affects your peripheral resistance. Next one, blood vessel radius. The smaller the blood vessel, the more resistance you have. Right? The larger the blood vessel, the less resistance you're going to have. Right? That's just common sense. So remember then, the blood pressure then is going to be affected by the peripheral resistance. How do you call this? When the blood vessel, for example, has certain length and you make it smaller, then that's going to be vasoconstriction. And if it's smaller, you make it larger, that's going to be vasodilation. So as you can see here, the blood vessel has a larger area right here. So then this is going to produce less resistance than if this one is smaller. Okay, so then obviously the arterial radius, which is distance from the middle to the side, obviously if it's smaller, you're going to have less, you're going to have more resistance. And they're trying to show you that in here as well with more numbers. So again, they're showing two blood vessels. This blood vessel has less resistance than this blood vessel because obviously this one is small, the lumen is smaller. So if you keep scrolling down, you're going to have in here, blood vessel velocity in different areas. Doesn't make any sense to you at this time. That's not important for what you need to do. Regulation of blood pressure and flow. Obviously, the regulation is going to be done by multiple different ways to control it. You have local control. For example, if you have an area that is going to have low blood for whatever reason, then you're going to start accumulating a whole bunch of carbon dioxide because you don't have enough flow of blood in there. You're going to have less oxygen. Since you have a lot of carbon dioxide, then the pH will drop, so that area is going to become acidic. So therefore, that's going to trigger, right, the vasodilation of this area, so you can get more blood in there, so you can actually eliminate the carbon dioxide and increase the pH in those areas. Since you increase, obviously, the amount of blood that is going to be in that area because you're going to produce vasodilation, a lot of times that's called reactive hyperemia. Okay. Here, this is not important because it says you don't need to know this. Angiogenesis is the production or the growth of more blood vessels, because if you lack oxygen, one way that you can do the opposite is that providing more blood vessels in that area to give them more oxygen. But that doesn't happen a lot of times. And a lot of times when this happens, it's not something that is normal. It causes problems. Okay, and again, you don't need to know that. Neural control. Neural control, we already talked about this. Our brain can control the amount of blood that you're going to get in different areas because we have baroreceptors and we have chemoreceptors. You have in here baroreceptors, chemoreceptors. Baroreceptors, again, they are going to decrease the blood pressure. Right? If the blood pressure is elevated, right, what's going to happen? You're going to produce vasomotor control of that. You're going to inhibit that. Therefore, you're going to produce vasodilation. Vasodilation increases the size of the blood vessel. Therefore, the blood pressure decreases because the peripheral resistance decreases. And again, this is too much detail. You don't need to know that. You just need to know that you have baroreceptors and chemoreceptors. The baroreceptors are going to increase or decrease the blood pressure according to your metabolic needs. Same thing with chemoreceptors. You have carbon dioxide, you have oxygen. The more carbon dioxide you have in certain areas of your body are going to allow you to increase or decrease the blood pressure. Ischemic reflexes, that's basically the one that relates to your brain. If your brain senses that you have low levels of oxygen in your brain, then your brain immediately is going to trigger baroreceptors to increase the blood pressure and therefore to increase the blood flow in your brain, so your brain can get the necessary amount of oxygen that it needs. Because obviously your brain, if it doesn't have oxygen, it stops working and then you will pass out, and obviously you may even get brain damage. Again, chemoreceptors, we've talked about carbon dioxide already. Medullary, as I was telling you, this is for the brain. So in addition to that, we also have hormonal control.